Chapter 15, Public Health Enemy Number 1, Tobacco Source. Introduction to Public Health by Mary-Jane Schneider. Jones and Bartlett learning few threats have caused as much long-term harm to public health as tobacco. Smoking is the leading cause of preventable death in the United States, linked to cancer, heart disease, stroke, and chronic lung conditions. In this video, we'll explore the biomedical reasons tobacco is dangerous, the public health campaigns that reduce smoking, and the evolving challenges from e-cigarettes and industry tactics. Disease is caused by smoking. Smoking harms nearly every organ in the body. It causes cardiovascular disease, lung cancer and other cancers, COPD bronchitis, pneumonia and reduced immune function, low birth weight, SIDS and infant deaths, fires and burns from smoking-related accidents. Tobacco has killed over 20 million Americans since 1965. The biomedical basis. Why is smoking so harmful? Nicotine is highly addictive. It increases heart rate and blood pressure and narrows blood vessels. Tar is the sticky residue that coats lungs and causes cancer. It paralyzes cilia, irritates airways, and leads to chronic inflammation. Carbon monoxide binds to hemoglobin, reducing oxygen in the blood. Other chemicals like arsenic and benzene also damage DNA, raise cholesterol, and promote blood clots. In short, smoking delivers toxins directly into your bloodstream with every puff. A century of tobacco use. Americans started smoking in large numbers in the early 20th century. Cigarettes were included in soldiers' rations during the World Wars. By the mid-1960s, 42% of U.S. adults smoked. The 1964 Surgeon General's report changed everything. For the first time, the government declared smoking causes cancer. Over time, rates declined, especially among educated groups. But lung cancer rates didn't peak until decades later. Who still smokes? Today, about 14% of US adults still smoke, but the rates aren't equal. Smoking is higher among people with less education. American Indians and Alaskan Natives have the highest smoking rates. Women's lung cancer rates rose later than men's, but are now equal. African American men once had the highest rates, but have seen declines. Tobacco-related disparities are still very real. Regulation and policy. Public health fought back with education and regulation. Warning labels on cigarette packs. Ban on TV radio cigarette ads in 1971. Indoor smoking bans, taxes on tobacco products. Non-smokers' rights movements in the 1990s. 1992. EPA declared second-hand smoke a carcinogen. Today, most states ban smoking in workplaces, restaurants, and bars. Youth targeting and industry tactics. Tobacco companies need 1 million new smokers every year to replace those who quit or die. They target teens through ads like Joe Camel, young women with messages about weight loss, minority communities using flavored cigarettes and local sponsorships. Laws prohibit tobacco sales to minors, but enforcement is often weak. The power of taxes. The most effective way to reduce youth smoking? Raise the price. Teens are price sensitive. When cigarettes cost more, they smoke less. States like California raised cigarette taxes to fund anti-smoking campaigns and saw major declines. California's tobacco control success. In 1989, California passed a 25-cent cigarette tax, funding a statewide campaign. They used media ads, school education, policy change like bans in workplaces. Smoking rates dropped to 11% by 2017. The program became a model for the nation. Their most powerful insight? Anti-industry messages exposing manipulation worked best. The 1990s legal showdown. By the 1990s, public health went on offense. States filed class action lawsuits. Internal documents were leaked. FDA tried to regulate tobacco as a drug. Tobacco companies were forced to pay and defend themselves in court and Congress. The Master Settlement Agreement. In 1998, tobacco companies settled with 46 states, agreed to pay $206 billion over 25 years, funded the Truth Campaign, restricted ads targeting kids, banned sponsorships of sporting events. But here's the downside. Most states used the money to fix budgets, not to fund tobacco control. FDA regulation and the 2009 law. In 2009, Congress gave the FDA power to regulate tobacco. The law. banned flavored cigarettes except menthol, required graphic warning labels, forbade ads targeting youth, forced disclosure of ingredients. A major victory for public health, but industry lobbying remains strong. E cigarettes and vaping. E cigarettes are the new frontier. Between 2010 and 2013, awareness doubled. By 2019, vaping had become the most popular tobacco product among teens. Flavors like mango, cotton candy, and bubble gum attract youth, and because they are marketed as safe alternatives, many teens start vaping without understanding the risks. The 2019 outbreak of lung injuries linked to vaping THC highlighted the need for regulation. Conclusion: smoking has declined, but it's still a public health crisis. Tobacco causes disease, addiction, death, and economic costs. We've made progress through regulation, education, taxation, litigation, social change, but the industry adapts, and so must public health. Victory depends on vigilance, science, and making sure the next generation never starts. Call to action. This video is based on chapter 15 of Introduction to Public Health by Mary-Jane Schneider. If this helped you understand tobacco's public health impact, share it and comment. What do you think is the most effective strategy to reduce tobacco use today?